For decades, cortisone shots have been standard treatments for joint pain and joint injuries in orthopedic surgery and medical practices. If you've had one, should you be worried that the pain relief you got from that steroid injection wore off? I'll share my thoughts in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Now, what's important to note, this can be a very simple answer, although I'll go into a little bit more detail, but basically the problem with cortisone shots and any other steroid injection into a joint is that it's not treating the underlying problem. It's purely an anti-inflammatory, essentially a painkiller, but it's not actually reversing the damage. If it's in the shoulder for what we used to call tendonitis or bursitis, but a rotator cuff impingement or shoulder impingement, that cortisone is not changing or improving the tendinosis in that rotator cuff tendon. If it's in the knee, it's not making the articular cartilage and bone from osteoarthritis, it's not filling that back in or making it normal. If it's a meniscus tear, it's not healing the meniscus. It's purely providing pain relief. The only time that potentially the cortisone might actually get rid of the problem would be in a bursitis situation, such as a trochanteric bursitis on the outside of the hip, where that pain is purely from potentially the inflammation of that bursa. Now, a lot of times, even trochanteric bursitis, there's some underlying tendinosis of the tendons under that, so that's not even perfect. But there are some times or some diagnoses that cortisone might potentially get rid of the entire problem, but that's rare. That's one of the reasons I particularly don't like cortisone, is that it doesn't fix the underlying problem. And cortisone, as I've talked about in a number of other videos on this channel, has risks. It can actually weaken or damage articular cartilage and make it break down faster. It can weaken tendons and make them more likely to rupture or less likely to heal. So I think that it's a lot of times not a great first line option for most orthopedic injuries and conditions. Now, if you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, you can click the link in the description under this video to fill out the contact form to potentially schedule an appointment with me. I'd also love to hear your experience with your injury, so leave those in the comments below. Just know that if you do leave a question in those comments, I can't offer you medical advice there, but I might answer your question in a future video. Make sure to subscribe to my channel and click the bell to be notified when I release a new video, such as starting my live streams, my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.